Here's what they're not telling you about, where that information is going. I'm on the waiting list like 1,000 of you. I dug into the legal docs, the partnerships, and the fine print. What I found, your health information and data might be worth more to insurance companies than to you. Surprise! And it's totally legal. I'm Edna, decade in tech. I help software engineers and technical leaders work smarter with AI every day. So hit that subscribe button and let's level up together. And just to say thank you, here's a cute picture of my dog, Caden. ChatGPT Health partners with Be.Well Connected Health, a company that sells platforms to insurance companies. Their marketing literally says they help insurance companies to know your members before you get your first claim. Think about that before you file a claim. When you're connecting your medical records, basically your diagnosis, your lab results, your meds, your Apple Health, which covers your heart rate, movement, MyFitnessPal, what you eat, and lastly, your Whoop or Oura Ring, they're gonna know about your stress levels, anxiety, and everything. You're not just organizing your health, you're building your insurance risk profile. The AI gets 30 to 40 times more data from your apps than your medical records. And the worst part, those type of data are not protected by HIPAA. Stay with me because in minute 5, I'm going to show you the exact legal loophole that they're using. And at minute 7, how they can quietly change your insurance costs without you knowing. Okay, let me show you the volume of data that we're talking about. Red bars, that's high volume surveillance data. Your official medical records has about maybe 500 data points monthly, but your wearable devices each could have 18,000 data points monthly. That's basically your heart rate every minute, your sleep stages every hour, your steps, your stress, your behavior patterns, constantly streamed to servers you don't control. Privacy researchers call this longitudinal, cross-context health profile. Translation, a complete surveillance file on you. Not just as a patient, but basically summarized to risk score. US healthcare is $5 trillion industry. ChatGPT Health positions itself as the front door to that. And whoever controls that front door controls enormous economic leverage. Be.Well Connected Health sells your medical records to insurance companies. Go look at it. All of their customers are other health plans, not any sort of patients. And their pitch to their customers, to health insurance companies, is get to know your members before they file claims. Your detailed behavioral data, your workout skipped, your sleep declining, your stress elevated, your diet changes, it all becomes a predictive modeling for who's likely to file expensive claims, who should get higher premiums, and who gets steered towards high deductible plans. No evidence of direct data sales just yet. But guess what? The marketplace infra is being built for it right now. You're not the customer. You're the inventory being cataloged for buyers. But it's protected by HIPAA, right? Wrong. HIPAA covers covered entities like your doctor, your hospital, your insurance company. Consumer tech companies usually operating voluntary platforms, not covered. ChatGPT Health is structured as a consumer product that you choose to share your data with. That choice, that consent, is outside HIPAA. OpenAI says the data is encrypted and it won't use your data to train models. Fine. But they can still sell the insights that are derived from it. Risk scores, predictive health analytics, and de-identified patterns. But here's the trick. Combining anonymized datasets has proven that it's easy to re-identify. Researchers proved 87% re-identification accuracy just by using zip code, age, and a few health markers. Justify anonymized means we just removed your name from the data. Everything else we left behind. Privacy researchers LaTanya Sweeney said, data is toxic waste, valuable, but incredibly dangerous depending on who holds it. Stick around because I'm going to show you how exactly this gonna play out in real life. It's worse than you think. Here's a real world example. Imagine you're 32, healthy, and you connect all of your data. Let's say your 6 months of AI analyses reads, Oura Ring, sleep quality declining by 15%. Apple Health, skipped workouts 3 consecutive weeks. Food log, alcohol consumption up 40%. Search history in ChatGPT, managing work stress. Pharmacy data, stop taking preventative medication. So AI flags you. Elevated risk for chronic metabolic condition. That assessment then is shared with the insurance ecosystem as aggregated, de-identified insights for improving health outcomes. Here's what happens next. During the open enrollment, you are now algorithmically steered towards high deductible plans. Your premium cost goes up, let's say, by 10% compared to your equally healthy friends who didn't connect their data. You get targeted ads for how to manage diabetes before you even are diagnosed. Your in-network specialist access gets deprioritized somehow. And this is all legal. You won't even get a notification. The interface itself still gonna feel helpful, still gonna remind you to take your meds and refill them, still gonna remind you about your appointment and how to prep for them and give you health tips. So it's all helpful, right? But behind the scenes, you're getting profiled, scored, and priced accordingly. And now let me show you how the scoring works. 40% risk score generated automatically from your fitness tracker and sleep rings. This number that you never see could cost you thousands in higher premiums, all from data you thought was helping you optimize your morning run. I'm still on the waiting list. If I get in, maybe I'll activate it, but I'm not going to connect everything. Here's your action plan. Read the actual terms. Things like privacy policy sections on data sharing, service provider access clauses, data retention and deletion policies. Second, selective connection strategy. Medical records may be useful. Real-time behavioral tracking, I would say reconsider. Lastly, ask before connecting. Who can access this data? Can it be fully deleted? What happens if the company gets acquired? Are there revenue sharing agreements with health plans? If this changed how you are thinking about ChatGPT Health, go ahead and smash that like button. And if you haven't subscribed to my channel, please consider doing that. And now I leave you, like I always do, with a joke, because no matter what, life is too short not to laugh. What's an AI health assistant's favorite exercise? Data crunches. I'll see you in the next one.